as we are waiting for everybody to come in, I would like first of all to say thank you to Dawn for giving us this opportunity to talk a little bit more about female cycle for women with Fabry. The idea was taken from your excellent presentation in Lisbon. So. And with that combined, we made a survey as well, and you will see later on the presentation a QR code that you can scan and you can go through the survey. And it's very important for us to fill it in. Also, I would like to say that this webinar is in collaboration with Chiesi, and I would like to personally thank Sonia for this happened. Also with us, we have Neil, who is who is an external facilitator, and he helped mostly with the presentation and the survey as well. I also would like always to thank Charlotte before we start, because she always do all things put together in the right order. I would like to say that this webinar will be, and it is recorded, and it will be recorded throughout, and it's going to be up next week on our YouTube channel for someone that couldn't attend today, but it will be only the Dawn's presentation, not the Q&A section. Also, we may have some pharma with us, but they're allowed to attend, but they're not allowed to ask any questions. I'm sorry. This is for patients and patient relatives webinar. So please close your microphones. Write down your questions, even on your pad, or write on the chat, and we will answer them or try to answer them after Dawn's presentation. So without further ado, I will give the floor to you, and thank you again very much.
Thank you, Mary. This has been a great experience talking with Mary and Neil and Charlotte and figuring out what made the most sense to do today, and then dividing up with my good friend, Dr. Rob, to figure out how between the two of us we can really think about it as a team, right? Because I feel like when I talk about being a woman with Fabry disease, I am just filtering all the information I've got from studies and what you guys tell me, and really you guys are the experts. Here is really to talk about the next level of being a woman with Fabry disease, and then moving directly into actual experiences with Mary, and then spending lots of time discussing and learning from you and seeing if there's things we know that can help support you and as you go on your journey. So here we go. This is kind of just looking at how it's going to flow. Mary really described it very well, and this is just kind of emphasizing what we're going to do today. There's me, there's Mary. All right. Talk about the life cycle. And when I say life cycle, I mean, what does it mean to be a woman with Fabry disease in different time points of your life? And some things go throughout your entire time life. And I'm going to break down what it's like to be a smaller child with Fabry disease and being a girl, what's it like to be sort of your middle prime of life, and what it's like to be, you know, a little later in life, which is still an amazing time of life. Don't get me wrong. All right. One of the things that I think women with Fabry disease encounter in the first time is that it can be very hard for your providers to tell you what is going to happen. Nobody has a crystal ball, but we do know the vast majority of women who have Fabry disease are going to have life-impacting symptoms, some things that are really going to change your life, and symptoms that are going to be something you need to overcome or get treated for. However, this often is ignored, even though through the years, starting in 2007, we've got these great publications that explain things very clearly, that women have Fabry disease, they have significant burden. And, you know, this great paper from Spain that I always talk about, where it took a bunch of women who were like, no, I don't have any symptoms of Fabry disease. But when they asked them specific symptoms and then did a bunch of studies, they found the majority of women who felt they didn't have symptoms did actually have symptoms of Fabry disease. But it was just normal for them. So they weren't thinking about them as they being affected. I think the biggest myths that we are still fighting in Fabry disease is that women are not carriers, they have symptoms, with the literature showing us that more than 69% of women have life impacting symptoms, and the idea that women are not men. I feel like every time we talk about Fabry disease, we say, well, less women than men have symptoms, or men may start this a little bit earlier. I think we need to stop that. And we need to talk about women with Fabry disease versus women who do not have Fabry disease, or women who have other chronic diseases and how it compares. And there was a great paper that finally came out just this year that talks about women compared to other women and how it impacts things. And I've sprinkled some of the information from that study throughout this study so we can think about it. The first thing to talk about is why. Why do some women have more symptoms and some women have less symptoms? And the way that I think about it is that every woman has two X chromosomes. One we got from our mom, one we got from our dad. And in the vast majority of cases, only one of those chromosomes that makes us have that X has a change in it, change in the GLA gene, that means that you're not making enough alpha galactosidase A enzyme. Bottom line, one GLA gene on one X chromosome works, and one GLA gene on the other chromosome does not work. And early before we're even born, one of our X chromosomes turns off. I'm like, okay, which one is it? Well, that's where this concept called X inactivation comes up. So every woman has different populations of X's that are on or off. I kind of think about like being a calico cat, right? All women have patches of orange over here, black over here, red over here. And when it comes to Fabry disease, the same thing is with the number of enzymes you have. Over here in your heart, you might have less enzyme. Over here in your kidneys, you may have more enzyme. But we can't predict because we're not going to take pieces of everybody and figure out how much enzyme each part of their cell has. But one cell, before you're born, becomes a large amount of cells that are daughters of that one cell. So depending if your X's are on or off in a particular area of your body, things can be completely different. So you might have different symptoms as a woman with Fabry disease from your sister, who might have different symptoms from your other sister, who might have different symptoms from your mom or your aunt. And that's why I feel like sometimes healthcare providers get a little wishy-washy and what's going to happen to me, what symptoms I'm going to have, because every woman is so different. You just have to treat them individually as an individual and look at you from head to toe and watch how it changes over time. Because it's an activation that makes things. You've got the change in the gene that's affecting you. And then we know that certain cell types don't share. They didn't go to kindergarten. They didn't figure out how to share their enzyme. So one kidney cell may have lots of enzyme and the other one may not. And all those things combine together to make you, and determine the impact Fabry disease is having on you. Not to mention all the other things in our lives, like maybe in your family, you have high cholesterol. So a woman could have Fabry disease plus high cholesterol, plus that leading to other symptoms. Or family, you've got diabetes. So all of these come together to make your life very different than somebody else who's also in your family. So no standardization. So that's okay. We just treat women as women, right? But the other thing we know is that across in Fabry disease, you have more than one kind of Fabry disease. We call it phenotypes, we call it classes, it doesn't really matter. But what the important thing is that some people are more likely, we got a little interference, there we go. Women are more likely if they have certain gene changes that are more severe, so they make less part of an enzyme, the alpha galactosidase enzyme is just not as functional or doesn't exist at all, they were what we call classic. Classic is just a way of saying more severe end. With classic Fabry disease in women and men, we expect to see symptoms that begin in childhood, and we expect to see things like the angiokeratomas, the burning pain, the lack of sweat, and it impacts the whole body. Over time, it gets worse without therapy, and we expect earlier things with heart problems and heart rhythms and increased risk for stroke and kidney disease, right? Every woman's going to be a little bit different, but overall, this is a more severe form. On the other hand, we have what we consider everything else. We call it non-classic or later onset. It is too big of a bucket. We need to work on making more variations so we understand it better. But right now, the way you get classified as non-classic or later onset is to be a woman or a man who has Fabry disease with a change that has a little bit of enzyme. Still not enough, still going to be very life impacting, But instead of seeing those early signs of pain and the early signs of not sweating, you may not see those as much. You may see more things that happen early, like early heart disease, early kidney disease, early strokes. So when you think about later, I want you to think about something that's still really life impacting, but maybe doesn't start in the first, years of life. Maybe it starts when you're a young adult. Maybe it starts when you're 30, 40, 50. Because this is really a big mix of people in this one category. But the bottom line is maybe not having symptoms when you're a kid. Hopefully that makes sense. So we've got this whole spectrum of people, those who start having symptoms as kids and those who don't usually have symptoms as kids. Okay, so if we look at this is our spectrum of women with Fabry disease. We all are on the same page and we know there's different symptoms that each woman will have. I'm going to talk in just more general pieces as you go through different times of your life. So let's talk about first symptoms. This is some work that I did and it took a long time, you guys. I gave a version of this talk at the NFBF meeting. And I basically was like, these are my kids when I started this study, and they were like little kids. And these are my kids when I finished it, and they were like heading off to college and in high school. So this is one of those things that just reminds you that Fabry disease moves in such a way that we've got to watch long term. We can't just look one time and be like, oh, we're done. You have to look over many years. And this is a study where I followed little kids with Fabry disease through family history or newborn screening, and I followed them over 5 years. And what I found is that the girls had bloating and GI, so belly symptoms, that started as early as 8 months of age. And I found that having actual like abdominal pain as early as 2 years of age. And these are girls who have classic Fabry disease. These are girls who, were identified in most cases through other family members knowing they had it. But even more important, by the time they were 4, they were having burning pain in hands and feet. They were having decreased sweating. Although the girls I was following, which wasn't too many of them, they didn't lose the ability to sweat entirely, but they weren't even 6 yet. So you can see how things change over time. So the average age that women, little kids, were having symptoms was 18 months. Think about how young that is. That's just a year and a half. And that is looking at the girls, not even compared to the boys. So if girls are having these gastrointestinal symptoms like belly pain, like diarrhea, like constipation when they're under 18, that tells us that we need to really pay attention and see them on a regular basis from the time they're very young, because having those pains is keeping them out of school. And we know when you get kept out of school, then you fall behind. And if you're not able to do sports or physical activities, it can sometimes interfere with how you interact with your classmates or how your teachers see you, your coaches. So really what we need to think about is in girls with Fabry disease, if they're having issues with their stomach that look like inflammatory bowel disease or look like it's keeping them out of school, they need treatment. They need treatment early for not just the symptoms of their belly, but maybe treatment for Fabry disease as a whole. So that would be our enzyme replacement therapies or our chaperone therapies, depending on what's available. The other thing we don't talk about that much is this great work that showed that kids with Fabry disease have slow heartbeats. And that slow heartbeat can make it harder for them to exercise and to run and play like other kids. Now, this is not usually in a case where it makes them pass out or faint, but it's something that we see early, and it tells us that Fabry is affecting little girls and boys early, right? And if you look at this graph, you see the rate of girls that have this slow heartbeat, the sinus bradycardia, that's blue, and the boys is green. And it's about the same. We're talking about 11% versus 14%. So is it every kid? No. Is it when they're 2? Probably not. But it tells us that we need to recognize that being really tired, that fatigue, not being able to run and play with other kids may be related to this change in the heart rhythm as well. And there's other measurements they're doing now. They call it T1 mapping. They're doing with eyes that shows that we can see changes in the heart well before you would recognize them through normal matters. So what we're telling you is that childhood has some symptoms that we see and that it impacts how things begin in the early life. And it's something that we need to watch and monitor instead of just saying, oh, we'll watch the girls later when they're adults. We need to start watching them when they're little girls so we can help, treat and help improve their lives as they start as younger girls. Now, not everyone's going to have those symptoms, but we need to watch because the only way to know if it's happening is by watching and talking about specific symptoms. Do you have belly pain that hurts for 2 hours and prevents you from doing anything else? Do you have diarrhea and constipation that means you always have to know where the bathroom is when you're at school? These are questions we can ask pretty simply and then take to our doctors. Okay, so now what if you change a little bit? What if we move a little bit down the road and we talk about women who are now later teens, young adults, and adult women? Well, one thing that we noticed is that some women are having symptoms of Fabry disease that are really life impacting, like having an arrhythmia or a heart attack, or having a little mini stroke, or having serious kidney impact before they ever even get seen. And that's for women who are classic and non-classic. And that means that we're not watching and treating as early as we need to with women. If you look at that age at first visit, the average is 40 years old. We were just talking about that women have symptoms and can have them as early as 2 or 4 years of age. So I would argue that we need to change guidelines so that we specifically say that women need to be seen as children. And maybe not everybody's going to need something immediately, but at least we understand and we've talked about it and we've talked to the doctors about it. The other thing is that Fabry disease is very sneaky. Things happen inside your body when you have Fabry disease that may not show up to be tested or understood until later. I'm talking about things like this great part of this study that Boschner did. And it showed that if you looked at women with Fabry disease versus women with rheumatoid arthritis, bad inflammatory autoimmune disease, women with Fabry disease had worse scores for their overall health, their energy level, how well they can get around in the world, and mental health. So depression, anxiety plays a huge role, as much as women who have very recognized severe condition of rheumatoid arthritis. Or if you just looked from head, you would see major organ involvement. That means kidneys, hearts, brain, that is already impacted in over 62% of women. If you look at the number, it's not just one organ system. The Follow Me registry showed us that you could see involvement in at least 3 symptoms for over 71% of women. And I don't give you this just to give you all the numbers. I just want you to see that sneaky Fabry disease is impacting women more than you think it is. And if you are not thinking about it, then your doctor is not going to be thinking about it unless they spend lots of quality time with Fabry disease, which unfortunately there are not enough people who are able to do that. The other thing to know is that there can be changes in the kidney. This is from great work at University of Washington and Condell. We've seen this in multiple places. That are really seeing that you can have changes in how your kidneys work and how those deep kidney filtering units are able to work before you see protein in the urine. And this speaks to some guidelines that say, don't treat women until they have protein in their urine. Well, if there's already big changes happening in the kidneys, I don't think we can wait till people have protein in their urine or changes in their kidney function before we think about careful monitoring, careful care. And because treating the kidney is usually like a primary therapy plus something like a medication that helps get protein out of your body. It's a combination thing. And so you need somebody who knows what they're doing, taking a look at it. I'm not saying everybody needs biopsies. I'm just saying that we need to think about how we work with our doctors and how they treat kidneys early in women. And then there's a lot of pain. Women are strong. Women have lots of pains we don't talk about. Period pain, like who spends lots of time talking about that? Nobody. When you have Fabry, you have normal female pains plus more. And again, when we checked Fabry disease versus women with early rheumatoid arthritis and early cases of multiple sclerosis, people with Fabry disease had more pain than that. On things, right? Are you like, Dawn, quit telling us the bad news? I'm like, I know, but we need to understand and be on the same page. And then we can talk about the good news, which is how we do better, as how you help your doctors do better, and how you help your healthcare providers do better, and how you help advocate for yourself. So I'm not just here to be gloom and doom, but I wanted to remind you that women with Fabry disease, if you look at their quality of life, it is worse than women with other chronic diseases. And we never question whether women with multiple sclerosis or rheumatoid arthritis have problems and better, worse quality of life. So why are we asking them with Fabry disease? Why are we not believing that this condition has a significant impact on how they're able to get through their life and enjoy their life? We shouldn't be. We should just be taking it as you tell us. We also saw, in addition to quality of life, which is how well you're able to function and enjoy life, there is a reduced life expectancy, again, with gloom. But I'm just telling you this because we need to understand and help that. And we need to think about it more. So what are some things that are really impacting women as they pass the 50 mark? Well, this is what I was just telling you about women with Fabry disease have a decreased life expectancy compared to people who are out there in the standard world if they're not on therapy. Being on therapy changes this curve, but looking here, you can see that women with classic Fabry disease have a bigger impact on their life expectancy. Men with non-classic Fabry disease or women with non-classic, and all of this is different than the average woman. And my whole purpose in showing you this one is to remind you that sometimes people say, oh, women with Fabry disease never have classic Fabry disease. They're all non-classic. And I would argue, based on this great data from ARENS, that we do see a big difference in different kinds of Fabry disease. And it's different to be a woman with classic Fabry disease than it is to be a man or a woman with non-classic. But everybody having an impact on their life. This one is infant survival. When we say events, we just mean people who had things like kidney failure, who had strokes, who had heart attacks, who had bad arrhythmias, things like that. So this is just showing you that the more severe your Fabry disease as a woman, the earlier you may have one of those events without therapy. This is all without therapy. How about menopause? We are talking more about menopause and the changes that happen in women's bodies as they go, like after they have their kids and after they're moving past that period in life. The part that we think about as menopause is really perimenopause, when our body is like making you have hot flashes and suddenly making you sweat, even though you've never sweat before, and giving you more anxiety and this kind of thing. That's perimenopause. And that usually happens in our 40s. Menopause, still you can have some of those symptoms, but it's after you've had a year with no period. Now, if you've had an IUD or a device that you put in that prevents pregnancy, but also does localized hormones, sometimes you haven't had a period in a long time. So it can be a little harder to figure out when you're in menopause, but your doctor can help you figure that piece out. And then postmenopause is when you have no estrogen left and your body is telling you about it. So it increases the risk for heart disease and osteoporosis. And this is on top of Fabry disease symptoms. And there's some symptoms that you probably never knew that they were part of perimenopause or menopause. And these are things like brain zaps, right? Or dry mouth, or joint and muscle pain, things that nobody talks to you about. But if you bring up with a doctor who understands menopause, it can change your whole view on how you are and why you're having these changes in your brain and all these different symptoms and changes in your life. It's not just because you become a crotchety woman, right? It's because you're going through these changes that your body does, called menopause. The average time, when we bring it back around to Fabry disease, for an average woman to have menopause and for a woman with Fabry disease to have menopause is all the same. So it doesn't seem to change things whether you have Fabry disease or not with menopause. You would still expect to have perimenopause around the same time, and then actually having lack of hormones, menopause, around the same time. But the thing about being a woman with Fabry disease and going through menopause is a lot of the symptoms overlap. So we come to the question of, if you're having more burning pain in your hands and feet, is it because your Fabry disease is worsening, or is it because now you've got menopause plus Fabry disease? If you're having more things with forgetfulness, is that Fabry disease or is that Fabry plus menopause? And the only way to figure it out is to actually go in there and investigate what's happening. If you get treated with something like hormone replacement therapy through a patch that gives you estrogen, does that help some of the symptoms? Does it decrease your anxiety? Does it decrease some of your pain? A little bit of menopause. But if it's continuing on, we have to remember to treat as we would for just straight up Fabry disease symptoms like burning pain. If hormones didn't do it, then maybe menopause needs to be in there too. And there are lots of medications that when you're at increased for stroke, we try to avoid, like oral estrogen, but you can do patches, you can do localized use, like there's vaginal things you can use with estrogen cream. So just because you have Fabry disease, it doesn't keep you away from doing some of the treatment. You're going to hear more of that. Dr. Hopkins is going to talk a little bit more about that for you. But I want you to know that this is something that it's important to bring up your healthcare providers as you cross the 45 line, right? The 50 line. Because if you see changes in your body, they've got to treat the Fabry and they've got to treat the menopause in order to understand really what's happening with you and make things a little better. Okay, so what are things that affect people across the whole spectrum? Having babies, thinking about pregnancy, Fortunately, there's been some good studies that show that when you're a woman with Fabry disease, there doesn't seem to be a decreased ability to get pregnant. And most pregnancies go along pretty well, but you need to watch for some things like increased blood pressure or protein in the urine or increased swelling in the legs. And these are things it's important that your doctor understands if you're a woman with Fabry and you choose to get pregnant. The other thing to know is that depending on who talked to you when you first got your diagnosis, they may give you opinions about whether or not they think you should become pregnant. We are well beyond that. There is nobody should ever tell you that you should not get pregnant if you make the decision as yourself or with your partner that you would like to become pregnant. We all know that when you have Fabry disease, it's a genetic condition, which means as a woman, it's a 50-50 chance for each child that they could also have Fabry disease. But you are the person who makes that decision. You and your family decide about pregnancies and babies. Some people may choose to they try to find out if the baby has Fabry disease ahead of time so they know for information. Some people may terminate a pregnancy with Fabry disease. Some people may not care at all and just have their babies and just roll the dice and see when they're born. Other people may choose to go through in vitro fertilization, where you take the egg and the sperm and you put them together in the lab, you test for Fabry disease and only put back the babies without Fabry disease. All of these are options. And I think the important thing, the message to tell you is you decide about your body and your life. You decide, and then you learn what information you want to know when you're pregnant, after you're pregnant. These are all the things that you get to decide. And nobody should tell you any different. It's your individual choice. The other thing is that women should be treated when they have Fabry disease. As you might expect, if people were once told that they were unaffected carriers, then they weren't lining up for therapy. But we're at a point now when you need to understand that women absolutely should have therapy. And our goal is to do it before there's end organ damage or problems. And I think this slide is just there to show you that we need to start therapy as early as possible so that we can theoretically avoid the other health issues that happen later on. Not to say it doesn't still help. It still helps when you have symptoms, but the earlier we can start, I feel, and the data is showing that the better the outcomes are going to be. And if we can avoid anything from symptomatic up, I want that. And this is just some of the data showing the earlier you start therapy, the better things are. The other thing I wanted to just, as I wrap this up, is there's a great poster that was at World, which is this big meeting that we talk about Fabry disease at. And there was a poster from Julia Alton, and she's the, you probably have met her. She's wonderful. It's her birthday soon. She's the Canadian Disease Association director right now. And she looked into what do when they have Fabry disease, when they live in US, Canada, and Japan. And one of the things they found is that there is a stigma that women feel about having Fabry disease. They may feel guilt about passing this on to their children. They may feel they can't talk to people about it. They can't talk to their family about it. They felt that healthcare providers don't understand the impact of being a woman with Fabry disease and that they don't treat them in a way that's around the same as when men get treated. They also found that symptoms they have, they need better help understanding, and that Fabry is having a huge impact on them mentally, depression, anxiety, just worry, and that these are things that are really important to address when they have Fabry disease. So to sum it all up, I've got a couple sum up slides. One of the things that we're still overcoming is that women are asymptomatic carriers, that women with Fabry don't have symptoms. And we need to work on that. And we need to work on helping healthcare providers understand so they don't dismiss symptoms or just blame it on other things or just say, oh, well, that's just you getting older. We also need more data on being a woman with Fabry disease and when best to monitor and treat. But we know it tends to be earlier than some of the older guidelines and literature have it as. And we know that every country, every state does this a little bit differently. And so each country needs to figure out where they are and how they can move it forward from there. Because different women have symptoms, everybody needs to be treated as an individual and monitored individually. A lot of the times women are like, oh, now I've got protein in my urine. Oh, I've got lots of pain. Maybe it's time for me to start therapy. That's fine. But in a perfect world, we would start before you have these impacts that are already causing problems for your body and functioning. But you have to work with your healthcare provider and work with the policies of your country. And sometimes this can be a big fight. And I think this is a great time to hand it over to Mary to talk a little about what she has gone through and how all these things I just talked to you take it to a more personal level, and how she's really, empowered herself and worked with the healthcare providers to get her where she is today. So, Mary, it is yours.
Well, thank you very much. Thank you for an excellent presentation. And I couldn't agree more on what you said about that we need more data. And actually, we can, if we have more data on Fabry, we can actually change the guidelines at some point. We can ask for it. Can you change the slide for the previous one so we can have the QR code? Because on that, I would like to amplify that this is the QR code for the survey that we have done with the help of Dawn and Dr. Hopkin, of course, and Neil. And it will take you about 50 minutes to fill it in. And it's very important for us to have as many women with Fabry as possible. It will be up until the end of January, maybe even a little bit more, if we see that there is a lot of people having it. And on my personal experience, I would like to maybe refer to two very big events, let's say. The first one was when I was married, and we were talking about starting a family, and my doctor said he scared me to death. Actually, he said to me, I asked him because he was the first one I should ask. I thought in my mind, and I asked him how can I, be careful and with Fabry, and he said, I wouldn't do if I was you, and you have more than 40% risk of having kidney failure during your pregnancy or afterwards, and I wouldn't do it. He didn't give me any options. He didn't give me any recommendation of talking to another doctor, and he scared me to death that much that I didn't ask anybody else. And I get through this in my mind, even though I'm not in the health system. I'm a nurse anyway. I'm a registered nurse, so I know a little bit about it. But I was so much scared that I didn't ask anyone to help me. He took my ability to stand up for myself uh, and seek for better options. So that was the first one, and then the second, I would like to say that it was when I entered the perimenopause period, where I was feeling that I wasn't me. It wasn't me. All my symptoms, all my Fabry symptoms, let's say, amplified, were getting huge, like 100% more, and I didn't know what to do. I was lost. I couldn't recognize myself. But that was a few years ago, and I knew a little bit more about Fabry and myself, of course. So I didn't stop asking for help until I get it. And I think I will end my personal experience with that it took me long enough, but I stood for myself, and I asked for hormonal therapy, and yeah, it get me back to my normal, let's say, self. A little bit, more joint pain and a little bit more insomnia, but I was feeling like myself. So on that, I would like to thank you all and wait for questions, because I don't think why we shouldn't talk about that more, or if someone wants to share a story similar to mine, you are more than welcome to take the floor. Uh, mm,